On today's Farm Talk, we're talking about holistic veterinary medicine. Hi friends, it's Paul Ward here and welcome to Farm Talk. I'm excited today. We are out in Hidden Hills, California. And of course, if you have pets, dogs, cats, and especially horses, who better to talk to than our guest today, Dr. Rhiannon Fenton. Welcome to Farm Talk.
Thank you so much. It's wonderful being here.
And of course, we want to thank our sponsor, Opus Escrow. Now, first, starting off, you are not just a veterinarian or a veterinary doctor, you're a holistic veterinary medicine specialist.
Yes.
What is the difference between a traditional vet and yourself?
That is such a great question. And a lot of people don't know the difference between the two. So a traditional veterinary doctor went to vet school, got their degree, and then went into general practice and maybe went and got an internship, residency, board certified in surgery, dermatology, internal medicine, the like. A holistic practitioner, there is no board certification right now for holistic medicine, but what holistic medicine seeks to do is treat the whole patient. So a lot of times maybe a dog or a cat has a heart issue, but also an orthopedic issue or a kidney issue. You're going to be seeing different specialists for each of those issues. And sometimes the communication between all three practitioners doesn't occur the way that we would expect or want, and things can go missed. Whereas when you have a holistic practitioner who's looking at the whole body and looking at, okay, what drugs does the cardiologist have this cat or dog on? What drugs does the surgeon have it on for XYZ problems? And looking at how all these drugs affect the patient's whole system, balancing it all, and then supporting health with nutrition, herbs, antioxidants, whatever is needed to make the tissues actually healthy. That's something drugs and surgery don't do, right? They might correct or kill something like a bacteria or correct a fracture, but that doesn't promote healing per se. It'll set it up, but there's so many steps along the way where vitality is not the key there with surgery and drugs.
Right.
It just removes stuff or fixes something short term.
Right. So in essence, most doctors, veterinary doctors included, are kind of quick fixed focused, right? I mean, I've got hip pain and it's like, okay, well, take an Advil.
Right.
Right. And then maybe 5 hours later, take another one.
Right.
But you know, your hip is connected to your spine, connected to your neck, and you had a ski accident 10 years ago, and it's all kind of interconnected.
Yes.
And the same holds true for animals.
Yes. Yes. And not just musculoskeletal issues, so internal organ issues too. So let's say you have a liver issue. Well, your digestion's not going to be good. Maybe you have, bloat or gas as a result of the liver not being able to function properly. And maybe you're just looking at the large intestine, bloating, gassing, constipation, diarrhea, and you're not looking at, well, wait, where is this coming from? Is it actually localized to the large intestine or is it from somewhere else? You got to treat everything. Otherwise, you're just doing symptom abatement and not getting true health.
Right. So I would imagine that most folks are not really aware. I mean, people locally know of you, but they don't come to you just because, right? They're animal, primarily horses. Has an issue, and they think it's one thing and find out that it's related to something completely different.
Sometimes that happens. So you're right. And in addition, sometimes clients are looking exactly for someone like me, and thank God for Google, they can find me. But there's other clients where, and this happens more often than I'm happy to admit, people will take their pets to the hospital and not get the answers they're seeking. They'll leave with thousands of dollars worth of bills and still not know, well, what's wrong with my pet? Why didn't it get better? And those doctors don't know. And it's not because those doctors didn't do their job. It's just that if it's traditional, they have a limited toolbox. They have a limited number of tools in that box for which to get answers, do treatment, etc. Whereas with a holistic vet, they not only have that toolbox of traditional medicine, they have acupuncture, they have chiropractic, they have energy work, they have herbs, nutrition, everything, outside of that traditional toolbox to work with. So you have many different angles and options by which to try to fix things at the root.
You mentioned chiropractic and acupuncture. How does that work with a horse? I mean, I have to ask.
Okay, so long story short, no different than a human, right? Because we're mammals. At the end of the day, we're mammals. We have a central nervous system. The needles end up stimulating nerve fibers that go all the way to the brain. With brain mapping, this is like advanced scientific knowledge. With brain mapping, we're able to determine, and they've actually documented this, that when you stick a needle in the correct acupuncture point that's supposed to stimulate a particular area in the body, it actually lights up that part of the brain that we know off of brain mapping that neuroscientists have discovered, that it's all connected. So let's say, for instance, there's a stomach issue and we use a particular point on a stomach meridian, all of a sudden, okay, that stomach pain goes away. And it can go away like that. Other times it can take a little bit longer. You're trying to get things in balance. You're trying to get all the organs to be harmonious. And then also with acupuncture and chiropractic, musculoskeletal pain, central nervous pain, weakness, muscle atrophy, imbalances in the body, the pain that you talked about, ski accidents. Horses have accidents too. They can go over a jump and not land properly. Barrel racing, dogs that do agility, or just playing at home in the house, a cat that jumps off a ledge and doesn't make it to the other one. All of those things, acupuncture and chiropractic help them the same way that they help humans.
How do folks know that the animal has a problem? Because it doesn't say, hey, mom, hey, dad, I have pain in my lower back. How do they know?
Well, it's kind of like, do you have kids?
I do.
Okay. So at some point when your kids were babies, they couldn't talk either, right? But you kind of got used to their little nuances, ways of being, when they wanted to eat, when they needed to go to the bathroom, just the fussiness, looks on their face, whether they were quiet or content. Animals have the same thing, right? So, and they all have their own little unique personalities, their own little routines. Some of them will wake you up every morning because they want to go eat at 7 a.m. and then they need to go poop right after. Okay, well, what happens if all of a sudden they're not waking you up or not going poop right after, or they're having diarrhea? So sometimes these things are really obvious, and other times owners are like, I don't know what's wrong, but something just seems off. And then it's our job to figure that out.
Right. I watched a video where the dog, it was being walked by the owner, and it was kind of had a sideways walk where the back hind legs were kind of at an angle, and it was kind of walking, funny because the back legs were kind of sticking out from the front, and then the tail was only kind of, wagging to the left.
Right.
And,
correct.
That owner had the insight to call you. And how did you help that dog? Because in the follow-up video, the dog was walking as it should, and the tail was wagging, right and left.
Right. So, okay, so that was the video on my website, a before and after of Franklin, that you're referring to. So that dog, that owner is very, some people are just more in tune with their animals than others, just like some moms are more in tune with their babies than others. They know, they are just so connected, they can see that something's off. And some people, it takes a little longer to get them in, but we're still able to help. And so with Franklin, I think the owner could tell he wasn't walking right, or just not acting himself, or just kind of lethargic, not wanting to go on walks, not wanting to play as much, et cetera.
And he was still young.
He's still young.
Want to do that.
Right. So I examined him, and I use something called muscle testing, which is, the scientific term is applied kinesiology. So basically, I'm able to localize where in the body therapy is needed. It's not diagnostic, but it tells me where a weakness is. And that could be a weakness of an organ, weakness of a tendon, ligament, etc. And this is especially helpful when diagnostics are not telling us anything. So blood work can be normal, an MRI can be normal, X-rays, ultrasound can show nothing, and clients, even other vets, will be the loss, like, I don't know what to do. So muscle testing helps me basically reflex test the body and see, where is this weakness at? So with Franklin, if I recall correctly, he had TMJ, temporomandibular joint dysfunction, and that joint is the most dynamic joint in the body. It can move 6 ways all at once. A lot of nerves run through there that tell us about proprioception, which is how our bodies are moving in space and time. So like when you step off a curb, you know when your foot's going to land from your depth perception, balance, etc. So his proprioception was off, which is what was causing that swaying.
Interesting.
And not being able to balance properly. And dogs use their tails for balance. His was it was all off.
Right.
And then he also had some muscles that just weren't functioning properly. So I did acupuncture on those. And the way that I determine which muscles they are is with that reflex testing. So I can pinpoint where everything's at.
Right.
Once I got all those muscles relaxed and loosened up and the TMJ functioning properly again, then I did chiropractic.
Interesting.
And very important to note here is that with chiropractic, if the muscles are tight and they're not addressed properly and you go and try to put that joint back in place, the muscle is just going to pull it right back out if it's not functioning properly. If it's weak, it's not going to hold the adjustment. If it's too strong or too tight or has a knot in it, it'll pull that adjustment out. So it's very important to have the muscles balanced first before you go have chiropractic done.
Interesting. Now, why do you think most veterinary doctors, and maybe it's just the path of least resistance, go the quick route? I guess maybe that's just life in general, but you took a different path. What made you kind of follow your own course?
To answer the first part of that, veterinary school is extremely expensive and time consuming and a lifelong commitment. And then on top of it, once we graduate, we have continuing education that's required of us. That's more time, energy, money spent away from families, away from practice, those kinds of things. So to get certified in acupuncture, which is a 6-month-long course and requires traveling, typically to Florida or Colorado, depending on where you go, time and money, right? That's you're spending and losing by not working. And that's just one example. Chiropractic's the same. All these programs, all these extra little tools that you can learn cost time and money. And then on top of it, some of them don't fulfill the continuing education requirements. So it's extra on top of. So it can be a mental barrier for some, and some people straight out of vet school, they're starting to have their families, they're building their careers, they're trying to just get general practice down because just because you graduate from vet school doesn't mean you're ready to be a doctor right away. It takes time to learn how to, learn your way, learn your art. It's not just about the science.
Sure. Now, I did read that you knew from the age of 5 that you wanted to be a vet.
Yeah.
There might have been one other career that you were thinking about.
Yeah, dolphin training.
Which is animal related.
Yes. I love the ocean.
Okay.
So I'm glad I did the vet thing because I make a bigger difference doing that. But how did I know? I didn't have siblings growing up. We had a German Shepherd named Magnum. And I think I was 4 or 5 when we got him. And so he was like my brother. We were partners in crime. I would wake up early in the morning before my parents did. And I would take my blanket, go sleep with him and get in trouble because, it was dirty, whatever. They don't want me sleeping with the dog. Right. And I would pretend to doctor him. It just came naturally to me. And I kind of just took off from there. And then I was introduced to horses around the same age. And after that, it was just...
You were out.
Yeah.
That's amazing. Well, we can definitely tell. So you've written multiple articles, been published. I mean, just way too much to mention in our short show, but it's very impressive. There was something that you wrote about horses and the nose. What is that about?
Well, okay, so that is, you could consider that an organ in and of itself, right? So it's a sensory organ. Mm-hmm. Their ability to smell things is far beyond ours, right? The other thing that article really focused on too is when I do dentistry on horses, I look for facial symmetry. Mm-hmm. And so sometimes the nostrils can be uneven. And what I have found is if one nostril is higher or lower than the other, there's typically a muscle somewhere in the neck or forelimb or back that's tight, and it travels all the way up and it will actually pull that nostril up higher.
Interesting.
Or if they have a tooth issue and there's pain, they can kind of contract that side of their face just out of pain, like they can't relax.
Right.
So the nose is an indicator not just of, nasal discharge, cleanliness, their ability to smell. Smelling helps animals want to eat their food. If they can't smell, especially dogs and cats, sometimes they won't eat. So it's very much an important part of their vitality and wellness.
Interesting. Now you published that, and I'm sure it was widely read among your community. What did other folks have to say about that?
I'm constantly educating clients about, anything that they ask me about or that comes up. And so many of my appointments, nothing's planned, right? With animals, nothing is
right.
ever.
It's always different.
It's always different. So something could come up during a dental exam and I could say, see how this nostril's higher than the other. I wrote an article on this. It may be, let me send you the link, and later after the fact, after the appointment. And it usually helps clients connect the dots, makes things click, because I can say things in person, but conceptually until they see it on paper or see a picture of it, sometimes it just doesn't click in our heads.
Right.
Most of us are visual learners or learn by doing.
So what happens when clients take their horse, dog, cat to a traditional vet and it's misdiagnosed, right? And the problem is chronic and it's not getting better and they've spent thousands of dollars. and then they come to you kind of as a last resort almost.
Yeah.
How do you handle that situation?
Okay, so every new client, whether it's a dog, cat, horse, they need to fill out new patient forms, which basically gives me a history of the entire patient's record from the owner's perspective. And then I also require all the medical records from whatever vet they've seen, so I can see the scientific evidence and that doctor's medical notes and the owner's observations of their own pet. And the thing to really distinguish here is that owners know their pets better than vets do. However, they don't know medicine and science better than the vet does. So it's very much a teamwork effort of putting all that information together. So the owner sees how the animal behaves at home. Veterinarians don't always see that because they're not in the home unless they're a mobile vet, right? So a lot of really important details can go missed in hospitals. But because I'm a mobile vet and I'm coming into the home and I'm seeing the environment, sometimes I can ask certain questions that other vets may not have access to even think of asking, if that makes sense. Okay, so we start with the new patient forms, and I do a physical exam, and that's pretty basic: temperature, pulse, respiration, etc. Sometimes things are obvious, and sometimes things are not obvious. Make sure that all blood work is up to date. If there's x-rays needed, etc., either I'll send them out to referral to get that done on top of my exam, or I'll review what's already been done or draw blood, etc. Explain to the client, these are the further tests that need to be done because these weren't done and we could also be dealing with this. From there, I also use that muscle testing that I told you about, where I'm able to therapy localize where is the weakness. So let's say, for instance, the dog looks like it has, or let's say a horse looks like it has metabolic disease. So what that means basically is kind of the same in humans, where horses can get diabetes, but we don't call it that. We call it insulin resistance. And horses also get things such as hypothyroidism. They can get hyperthyroidism. I know it's a little controversial in my field because a lot of vets don't recognize that, but I've treated it and made it better on blood work. Cushing's is a common one. And Cushing's is an elevation of cortisol. So in dogs, it's more often there's a tumor on the pituitary gland or adrenal glands that's secreting excess hormone, and then they have excess cortisol in their blood circulating, and that causes downstream effects that aren't healthy. Same thing with horses. Typically in the pituitary gland, something is causing an excess secretion of hormone, and that cortisol rises. Now, when animals have these metabolic diseases, sometimes they have the symptoms of all of it, but the blood work won't show it yet, right? So the traditional vet will say, well, they don't have it yet, so let's not treat it. Or, well, we can try this drug and maybe it'll make things better. And my experience with that is sometimes it works, and by sometimes I mean 15%, and sometimes it doesn't work. Or the patient's allowed to continue down this path and spiral viciously in the wrong direction until it's caught by somebody. So where I step in, I try to keep that spiral from occurring in the first place. And the way that I do that is with muscle testing. So if blood work is normal, or let's say the client can't afford it, I'll muscle test and go through, okay, so how's the liver functioning? How's the spleen functioning? The pancreas, the stomach, small intestine, large intestine, pituitary gland? Do we have an excess of sugar in the blood? So I can muscle test the concept of anything, but just I have to tell the client, this is not diagnosis.
Right.
These are just things that the body is telling me it's resonating with, and we need to treat it. And then I'll ask, okay, do you need herb A, B, C, or D? Do you need acupuncture? Do you need laser therapy? So for instance, Cushing's can cause hypotension and poor circulation. And at night, these horses, Southern California, we're so lucky with the weather here.
Right.
But in the winter, when it gets cold, a lot of these horses, their hooves get cold at night. And then they don't want to move, don't want to walk. And you can see in the morning their tongues will be pale. So I'll put them on herbs to help with circulation. Well, what's the organ responsible for circulation? A lot of people think heart and kidney. It's not. It's liver. Your liver is also the one dealing with all the excess hormones and trying to get rid of it. But if it's full of toxins, it can't do that, which is very much related to Cushing's. So this goes back to the holistic thing of looking at the whole body, right, and trying to get health. So to go back to your question about what do I do when there's been misdiagnosis, I'm kind of like a little detective. And I get in there and I look at the whole body and I try to pinpoint everything and map it out. And I am a perfectionist and I like answers. So I will try to figure out every little thing and connect the dots and try to get to the root of stuff, not just here's a drug, let me know the symptoms are better. Like
Call me in 2 weeks.
Call me in 2 weeks. I am not that person. Like if someone wants that, they need to go somewhere else. If they want to know what's really going on and try to get to the root of problems, I'm the one for you.
For folks watching and listening, what kind of piece of preventative medicine would you suggest? I mean, you can't treat every horse out there.
Yeah.
But you probably see one occurrence or ailment more often than the others, or maybe there's a few that you see more often than others, and it was so preventable. What would you say that is, and how would a horse owner take care of their animal a little bit better?
Right. The number one cause of death in horses is colic. And so colic is an umbrella term for abdominal pain, discomfort, some type of dysfunction going on. And horses cannot throw up. They're neurologically incapable of doing so. So if they eat something or don't drink enough water and they get an impaction in their gut, many times they need surgery to have that impaction removed. And if not done so in a timely manner, they can die. Bunnies are the same way. So horses and bunnies are very similar. So with colic, again, we have to look at the whole body. What caused that colic in the first place? So was the stomach having ulcers? Was the liver not functioning properly? Did the small intestine have a lipoma that then, the horse laid down and rolled and they had a fatty tumor in there because their diet wasn't correct and they had metabolic syndrome going on? And then that thing wrapped around the small intestine and strangulated it. Well, how did that fatty tumor get there? And now they have to have their small intestine, part of it, removed.
Right.
But let's go back to the beginning and stop another lipoma from occurring again, or looking at the large intestine, et cetera. So that starts with, what are we feeding our horses? What type of water do they have access to? Is it city water? Is it well water? Are you cleaning the well out? Are you doing measurements for contamination levels, bacteria, heavy metals, toxins, et cetera? How often are you doing that?
Right.
The food is a huge thing right now because so much of our hay is commercially grown and not organic, and it's sprayed with herbicides, pesticides, even dyes to make it look green and to have the consumer attracted to it and think, oh, this is such great hay. If you see uniformly green hay without patches of some yellow and brown in there, walk away. So all of those toxins that accumulate in our air too, Southern California air isn't exactly clean, but we can't fix that. But we can focus on the things we can fix. So water and food, stay away from the sugary, senior feeds, that kind of stuff that have molasses in it. Read the labels, because some of the marketing is really, really good and it'll say there's no sugar added, and you look in there and the fifth ingredient is cane sugar molasses, and owners think they're doing something good by these horses that have diabetes, and they're not. They're actually making their horse worse.
Interesting.
So water, you can put a filter on it. It's not expensive. I recommend Camco. You can Google that. It's on Amazon. It's actually an RV water filter, and it makes things so that it's drinkable. People that have RVs, they use it for showering, so that you're showering with clean water, cooking with clean water, etc. And they also make a hose that doesn't have any chemicals in it, like lead, etc., that'll get leached. So those are options to help keep the water clean and inexpensive. And then the food, we can soak our hay. We can use steamers. There's certain companies that make steamers for hay. And then also just a consumer that's very aware, conscious, and discretionary about, they go to the feed store themselves, or if they're boarding, that's difficult because then that facility is bringing the hay in, right?
Right.
And that's
in mass on a big truck. And somebody else is feeding your animal.
They don't have a choice. And maybe they don't have the money to pay for their own hay for that horse on top of the board they're already paying to stay there, right? So in those cases, I say, all right, we'll look into a product that helps with remediation of the damage that occurs with eating that type of hay. And there is a company called Advanced Biological Concepts, and they make a product. It's called glyphosate. It's like a glyphosate remediation product, and it helps the body deal with all the toxins that they're ingesting from this hay and pesticides. So these types of basic things can be so helpful for horses. It seems so simple that it should just be common knowledge, but it's not, unfortunately.
Right.
But again, back to your question, preventative water and food, keeping that as clean as possible. That's where you want to start. That's what they're taking in every day.
Yep.
We are what we eat.
That's right. Everybody.
Yeah.
Yep.
I have a client who, her horse just got, a young horse, 8 years old, from Spain, beautiful Andalusian, just got diagnosed with Cushing's, insulin resistance, leptin resistance, and likely thyroid issues too. He's overweight, and she attributed it to lack of exercise over the winter because of all the rain and not being able to use the arena. And
is he an older horse?
He's young.
Oh, wow.
He's young. To have all these diseases is not common. And so she was just, let's fingers crossed, he just needs to go on a diet and exercise more. And I knew looking at this horse. I've been doing this long enough. I'm like, you can think that all you like. I know there's more going on here. You've told me you've already changed the diet and this is how he looks. And I just saw him 6 months ago and he didn't look like this. Overweight and just pendulous abdomen. So we ran the blood work and sure enough, he was positive for a lot of things. And she sent me an article, and just like any other article that I've read about equine metabolic syndrome, insulin resistance, Cushing's in horses, etc., the information is helpful, but it's also inaccurate many times. And it's very disappointing to me as a veterinarian reading this stuff because my clients also read it and think it's the Holy Grail because it's in print. And one of the articles that she sent to me basically said they came to some new conclusion in Australia that, keep the horses off sugar, the carbohydrates need to be low, the starch needs to be low. I mean, it was the same stuff just being said differently.
Right.
And in this article, it said, feed them fat instead.
Wow. Wow, that was in the article.
Yes. Feed them fat, feed them fat instead to help, keep a healthy weight on them, something to that extent. And the problem with that is in these articles, they're not going into the fact that these organs are dysfunctional because of the food that they've been on. So you may have had a healthy horse on timeline at 0. Then it got fed commercialized USA hay, commercialized USA grain, and now they got sick and their organs are not functioning properly. And you can't just throw better food at them and think that that's going to fix everything. Those organs have been damaged. And by organs, I mean the liver, the pancreas, the stomach, the small intestine, large intestine, the hormone organs, specifically in the brain, hypothalamus, pituitary gland that regulate all of this stuff. So by just changing the diet to maybe a different type of hay that's still not organic, still has herbicides and pesticides on it, and maybe changing to a lower sugar food or no sugar food isn't going to fix those organs. It'll slow down the vicious cycle, but those organs are still traveling down the road of damage and disease. And so in that article, when it said feed fat, it's like, okay, so you're focusing on no sugar and low starch and then not thinking about what the consequences are of increasing the fat. Well, if you increase the fat, what organs are working hard to deal with that? Pancreas and liver. What does the pancreas pump out? Insulin. What does the liver deal with? Every hormone organ you could possibly think of. So by increasing that fat, especially if the pancreas can't pump out lipase, which is the enzyme to break it down, they're going to get overloaded with fat and not be able to digest it. And then you're going to have colic.
Interesting.
And you're going to have fatty lipomas.
So you read an article, it's misinformation, you kind of do your own diagnosis, and based on that article, which is published in a reputable publication, and it just makes the problem that much worse.
It can, because clients just blindly, they just glom onto that information and think it's all true. But that article was written from a generalized standpoint on whatever animals they were doing their studies on. And heaven forbid it's on a breed that the owner has. Because then they're even more like, oh, this is the way, this is the truth and the light, But it's not. Their horse has special DNA and biochemistry unlike any other horse on this planet, regardless of breed, etc. They are an individual just like you and I. And how they got to their disease state was a specific individual journey, and the way out of it is going to be a specific individual journey as well, not some generalized random thing. I mean, it's just like giving them a drug.
Right. Interesting.
They have to have individualized care.
Interesting. How do you get the word out more to more people? I mean, we're here doing farm talk. How do you get the word out?
My work speaks for itself. I hardly ever advertise people. The word of mouth just spreads. And the animals, there's no placebo with animals, right? So what I do, they get better, and then that goes out into the world. And people see it, especially if I'm at public barns. They'll see, oh, wow, this horse is doing a lot better, or they're back at shows and winning again. So
interesting.
Yeah.
What does the future have in store for Vital Equine Holistic Veterinary Medicine?
Little by little, I hope to revolutionize the way that people think of healthcare for their pets. I really want to change the landscape by which they seek care. And we're already, because of COVID and because of the pandemic, people are already a little bit more aware. Like, we finally are aware of mental health, right? It's at the forefront now. Or
it was all kind of under the table and underground. Yes,
right.
Yes.
So I want the same thing to happen for pets, where we look at, how are they doing mentally? How are they doing emotionally? How are they doing spiritually? Because I practice all of that in my practice as well. We look at those things. And a lot of times the reason pets aren't getting better isn't because it's physical. It's something else along those realms, right? And so we as humans also have the same thing. It's come to the surface more because of COVID and the pandemic, So
interesting.
I want to revolutionize the pet industry with health.
Awesome.
Little by little.
I have to ask you about your name.
Yes.
Rhiannon.
Yes.
I'm a big Fleetwood Mac fan.
Uh-huh.
Were you named after the song?
Yes.
You were?
Yes. My dad was a big fan.
Awesome. And it has something to do with horses.
Yes. So in Celtic mythology, Rhiannon was goddess of horses. So it's just suiting. I think I manifested the name.
You were meant to be a holistic veterinary doctor. Absolutely.
Yeah.
So we're tucked away in LA County in Hidden Hills, California. Beautiful setting.
Mm-hmm.
Where exactly are we, and who are the folks that are clientele?
Okay, so typically the people who are already doing this type of work on themselves are seeking it for their animals as well. And then they have family or friends that will end up seeing the type of work that they're doing and then be interested, and then it trickles down to the pet, right? So in Southern California, we're a little bit more advanced in that area than some parts of the other, the country.
Mm-hmm.
So mostly Los Angeles, some Ventura County, some San Luis Obispo County.
Do you travel up there to San Luis?
I used to before the pandemic. I did, yeah, more frequently. All the way from San Diego to Paso Robles, I was going.
Wow, that's a big territory.
Yeah. So more local now.
Sure.
My horses are older, and I don't like leaving them. So
those are your kids.
Yes.
Well, Dr. Rhiannon Fenton, thank you so much for being our guest on this edition of Farm Talk. We've loved having you and learning what you have to share.
Thank you so much.
Absolutely. And of course, we want to thank our sponsor, Opus Escrow, and be sure to tune in for the next edition of Farm Talk.